Call the Health, Human, and Social Services Committee meeting to order, and I'd like a motion to open the meeting. Supervisor McDevitt, seconded by Supervisor Bramer. All those in favor?
Aye.
The first order of business is to approve last month's meeting. Would someone like to make that motion? Supervisor McDevitt, seconded by Supervisor Bramer. Any corrections or additions to the minutes? All right. All those in favor?
Aye.
Opposed? Carried. Thank you. Chris?
Good morning.
Good morning.
I only had one item this morning for your consideration, and that is to request a new contract with BOCES. This is our annual contract to prepare youth for the test assessing secondary completion, formerly GED. People still refer to it as GED. I always have to look it up what TASK stands for. But for the 2018-19 school year, the price, the county administrator had pointed out last year we approved the contract up to $15,900. The actual contract was $14,500. This year it's at $14,550. The only difference being some of their indirect cost charges. But contracts with both BOCES and SUNY Adirondack do not require any sort of procurement because they're considered part of the county government.
Right.
So we only reimburse them for their actual cost. So when we actually pay for the contract, they send us, a stack of information, yay thick, to document all of their expenses. So it's a reimbursement, really.
Okay. A motion to approve that? Supervisor McDevitt, seconded by Supervisor Bramer, and Peter has questions.
Just a question. This has to do with the GEDs, is that what you said? Yes. Just as an observation, something that's always bugged me about the GED program is that it almost appears as if we're making the qualification to pass GEDs more difficult. I think if I were to take a GED today, I would not be able to pass it. Okay, so it's just an observation that I think it's a trend that's going in the wrong direction. There are certain human beings in this world that need to get on with their lives, give them that fundamental piece of paper, and hopefully they can be a success at it. So
when the state switched from GED to TASK, the success rate went down considerably, but it has since started to come back up. And that's the reason why we send these kids to training. So hopefully, and we've had great success. The kids that do go to class, their success rate is much higher than the general public. So that's exactly why we do it.
thank you.
Yeah, thank you.
Good. Supervisor Bramer.
Thanks, Chairwoman. How many people do we send a year?
It varies from year to year, but it's around 10 if I were to pick an average. Yeah, it's not a huge number, and it's rolling admission. Basically, we pay for an instructor, and the instructor is there on Tuesday and Thursday afternoons, and we screen and enroll the youth and send them there. But it's up to them to decide if they want to continue. So we have kids that come in and out. They'll come for part of the year. They'll take part of the test and pass, and then come back. So it's a pretty fluid process, but any given time there's 5 or 6 kids, and it's about a kid at a time.
Thank you. Any other questions? All right. All those in favor?
Aye.
Opposed? Carried.
That's all I had. I just wanted to thank the supervisors that rushed down to the picnic on Friday, despite the rain.
It was a success as usual.
Yeah, I'll have a report at a future meeting on the actual numbers.
Okay, great. Thank you.
You're welcome.
All right. Have a good day.
Thanks, you too.
See you later, Chris.
Yeah, see you later.
Rob's next.
It was a good picnic.
Yes. I meant to go straight there, but then I don't think my son was waiting, so I missed almost all of it, but it looked really nice. It had a good turnout. By the time I got there, it was not raining.
Well,
Thank you.
Their parents are all happy. Thank you.
No, it's a success, definitely.
Yeah.
Good.
all set.
Okay, I have a few agenda items here and then a couple of informational updates that I want to provide. My first item is a resolution request to amend the 2018 Warren County budget to allow pass-through of $4,482. This is 100% state aid from the New York State Office of Mental Health. This was part of the direct care staff wage enhancements, and resolution request is included in the packet.
All right, someone like to make that motion? Supervisor McGowan, seconded by Supervisor McDevitt. Any questions? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
Okay, second item is a resolution request to extend the existing 2018 contract with Parsons Child and Family Center for provision of mental health home-based crisis intervention services. Current contract is set to expire on 11/28/18, and I'd like to stretch that term to the end of the year, get them on a calendar basis like our other contract agencies. It ended up off of the calendar basis due to an RFP that was issued a number of years ago, and it'd just be simpler. Our funding comes on an annual basis. We'd like to contract on an annual basis.
All right, makes sense. All right, Supervisor McGowan makes that a second to that, Supervisor Sokol. Any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you.
Next item is a resolution request to amend the 2018 contract with Northeast Parent and Child Society for children and youth mental health respite services. This is a request to add $4,000, 100% state aid from New York State Office of Mental Health, increasing the amount. The contract currently reads not to exceed $16,044. Would increase that to $20,044.
All right, someone like to make that motion? Supervisor McDevitt, seconded by Supervisor Loeb. Any discussion? Supervisor Bramer.
My question is, is this awarded pursuant to an RFP?
The respite services, I don't believe so. No. We have a pool of respite providers. Again, it's hard to find providers to do this service, but we have a pool of various providers that provide both hourly and overnight respite. And we manage that pool among those providers. Sometimes providers have access to the service, sometimes they don't. So we need to shift money around from provider to provider at times because we have kids on a waiting list that need the service. So we need to move it to the agency that's able to provide the service.
My concern though about going over $20,000 for this contract year is that
This is money already budgeted. It's currently in our budget. We're just shifting it from one agency pool to another contract.
I get that, but our policy is that we go out for an RFP if we're going to pay someone more than $20,000 a year.
Okay? Well, we
Yeah.
under $20,000 if you want. We can.
Rob, is there a state regulation that somehow overrides our local policy, or do we have to utilize the 20,000?
I think if you asked Julie Butler, she would say that ongoing state aid like this for mental health services, that there's an exception, but we can clarify that with her.
Okay.
Prefer we can keep it under 20,000.
Let's keep it at 20,000.
Want to make it just under 20,000?
Hopefully we'll be okay without the $44
Yeah, right.
for now. But I think there may be something like that, a health exception, health services, now you say that.
There are various exceptions, but even with those exceptions, it generally requires a certain process to, decide that you're going to go with one provider versus, doing a RFP or soliciting bids. So I do agree that if you keep it under 20,000, that'll just make it a lot easier.
Yeah, and in this circumstance, it's not a big deal. We're talking $44 or $45.
But can or maybe these guys will
Mr. McGowan.
Thank you. This is 100% covered by New York State, correct?
Yes, that's what it says. Mm-hmm.
So, it's really not a bid. and type thing as we're looking to bidding the service, that would be, would that be up to New York State to ask for that bid since it's 100%? I'm just...
It depends on the funding source. Some ID is here. I think for Office of the Aging, sometimes there are exceptions where if you abide by federal guidelines, you can do it by federal guidelines regardless of what the local procurement policies say. But in this case, if we want to be safe and knock it down $44 to $20,000, I think that's reasonable.
And if we can do that, I mean, I just wanted to bring that up, because it's just, I mean, I understand what the RPFs are for, and bidding and getting the lowest bidder, but on the other hand, too, this is 100% state aid, so, all right, I just familiarizing myself, thank you.
Sure.
Supervisor Lowe?
Thank you, Madam Chair. If I may, Rob, would you explain, you talked about respite services and the term you use as to who's providing those services slips my mind right at the moment, but who's receiving these services specifically? Not names, but what situations require these services, and who are the different people or entities in that pool?
Okay, so these are services provided to children and youth with serious mental illnesses. In the children's world, they don't actually call it serious mental illness, they call it serious emotional disturbance. But these are children that do have a mental health diagnosis and also a serious impairment in their functioning. And the idea behind providing respite is that it's a lower cost alternative, and if we can help families maintain intact, if we can help de-escalate crises, if we give families that are very stressed in parenting these situations planned opportunities for either hourly or overnight respite, that we can avoid emergency room visits, crises calls, potentially hospitalizations. So that's the kind of concept behind it, is that it does help divert from those higher, once things escalate, then you're talking higher cost interventions. The police might be called, or it might be trips to the emergency room, things like that. So that's the idea behind it. The providers are actually Northeast Parent and Child Society provides both hourly and overnight respite. We have Wait House, we have a crisis bed there that we contract for out of this pool of funds, and that's overnight respite. Glens Falls Hospital provides hourly respite for us. We've recently expanded the pool to include Capital District respite out of Albany. So those are the providers we have that we use.
Thank you. Thank you.
Supervisor Bramer, did you have a question?
No, I was going to try to add that when Northeast Parent and Child Society, like for this particular contract, they are working with other families in the community, correct, to place the children for an overnight respite situation?
Yeah, Northeast uses their therapeutic foster care homes. So these are trained parents, trained in de-escalation techniques, trained in working with seriously emotionally disturbed children. So when there's a vacancy in one of their therapeutic foster homes, we try to take advantage of that and use that opportunity as a respite opportunity.
Any other questions?
I'm in my 5th year of doing per diem respite work. I'm currently working with an 8-year-old and a 14-year-old, and certainly I've worked with, I think, 11 or 12 boys. The credentialing and certifications that we've got to go through, or the workers have to go through, is quite extensive. The people who do this are teachers from all walks of life, but they believe in the program, they believe in the youth. You can really see the direct results of the time that the men and women do this. Again, I've got one boy for 8 hours a month, another one for 10 hours a month, and oftentimes, just because of circumstances, you don't get to the maximum number of hours that you can do with an individual. So that $20,000 may only be $18,500, when you do all the accounting. I want to point that out.
Thank you, appreciate that. Mr. McDevitt and Mr. Loeb, if there's no more discussion, we need to change that resolution then so that it reads 20,000. Are you in agreement to change that?
Technically 19,999.
Okay, technically 19,999. But fellas, you're all set with that then?
Great.
All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
Then
Go
just
ahead,
a
Ron.
couple of informational updates. Earlier in the year, I made the committee aware of an effort to advocate with New York State for funding for jail-based substance use disorder services. There was a kind of a push on and during the budget process by my statewide association, in conjunction with the Sheriff's Association in New York State, to advocate for this funding. They were advocating for $12.8 million, and unfortunately, a lower amount made it into the budget. It's only 4-point-something million. So originally, with the $12.8 million, it was going to be spread across so the state and every county would get a piece. But unfortunately, with the lower amount, they ended up picking certain counties to get the funding. So we were unsuccessful there. But we have been looking for other opportunities to try to develop something in the jail. And so I'd like to introduce Carrie Wright is here today from my office. She's a program analyst. And Sean Lamry, of course, from the Sheriff's Office, if he wants to say anything about it. But Carrie, maybe you could come and just give a little bit of a description about a proposal that we've been in support of to try to develop something.
So I have been working with Cliff Green through the Association of Mental Health on, I don't know if you're all familiar with AHI, which is our PPS in the area. So they have some funds available through DSRIP called Innovation Funds, which I developed a proposal for with Baywood and AMH to introduce this community reentry coordinator position to work with Washington County Jail and Warren County Jails. To help low-level offenders once they're ready to be sent back out into the community with warm kind of wraparound services and handoffs and referrals. We know that once you have that type of thing in place, folks are less likely to reoffend. There's a high level of people in local jails that are severely mentally ill and also have SUD, substance use disorders. And we're currently really missing the mark on that, and people are being sent back out into the community and costing everyone more money and really not doing well as individuals. So this position, we're really hoping we'll be able to get funded again. It's only a year for funding, but it's really kind of, as Rob spoke to our association, it's just where things are headed, that there's going to be more funding opportunities. So we're going to continue to look for that and see what else is available, but I just think this position will be really critical to help folks as they're re-entering the community from the jails. And Sean has some numbers on the census in Warren County and how full the jail is here, as well as the SMI.
Thank you. Sean?
Good morning.
Good morning.
Sheriff York couldn't be here this morning, so I'm speaking on his behalf. Rob and Carrie had reached out to me about this. They know that we feel very strongly about doing more to provide mental health treatment to inmates when they get released from the facility. Went to a conference about a year and a half ago, and there's been a huge reduction in funding out there for people with mental illness. As of today, this morning, we have a population in our facility of 140 inmates. Of those, 104 receive medications on a daily basis. Of the 140, 67 are currently on psychiatric drugs. And of the 140, between 75 and 80 are being seen for mental health issues. As you can see, it's not really a surprise to us. We know that prisons and jails have become the dumping grounds for the mentally ill. They can't function in society without proper treatment, proper medication. As Terry said, they often commit low-level crimes, and where's it get them? It gets them back in jail. They can't follow the rules. Sometimes they become assaultive, combative, and now they get higher-level charges. And it's like a cat chasing its tail. They stay in jail. That's really not the place for them. If you think that somebody's going to get really good mental health treatment by being in jail or prison, you're sadly mistaken. We know that inmates, when they get out, they're at a much higher risk to overdose. There was recently an article, I think it was in Newsweek, that they're 40 times more likely to overdose within the following 2 weeks when they get out of the correctional facility. So get some sort of a transition position that can help get people set up with the services when they get out of a correctional facility. One, it's better for those people overall, and two, it's going to be a cost savings. I believe the town won't be coming back to the correctional facility. And as you're aware, our population is up quite a bit over what it was a year ago.
Thank you, Sean. Question, Bill?
Thank you, Madam Chair. If there was ever a time when the media should have been here, it was to hear that statement from the undersheriff. We hear that statement from mental health officials all the time, and people say, yeah, but the sheriff's got it all under control. This is a missed opportunity. That's great information that the public should have. And maybe we could save that for another time when the media is here, because that's what the mental health people have been saying for years, and when 6 years ago when the budget started being cut, it was quite clear that what was going to happen in society was everybody was going to funnel from the mental health programs to the prisons, and that's exactly what has happened. Thank you.
You're welcome. Anyone else?
Just a quick comment. I have an acquaintance of an acquaintance that I think is currently incarcerated at the Warren County facility, and this is a gentleman that had a strong background in the automobile industry. He did a couple of things. He took a Maserati from an automobile dealership in Albany and decided to hold on to it for it's a $100,000 automobile, and he just kept it for about a week until he returned it. Okay, and these are automobiles that typically you don't take that vehicle out unless you have a salesman with you. Okay, so he's out doing that. This guy has got a significant, is mentally challenged. He's got some issues that he's not on his medication. He then proceeded on another day to, was in a bar in Lake George, and he convinced a gentleman from Long Island that he needed docking space. He took $500 from this gentleman from Long Island, and he obviously did not control any of the docking space. So my point is, people do crazy things when they're not on their meds, and this is a guy that is the revolving door. He's been incarcerated 2 or 3 times, minor type stuff in the scheme of things, totally nonviolent, but he goes off his meds and he takes off with the Maserati, so.
Ms. Bramer?
Thank you, Joe. This is great to hear that there's this opportunity. Is it actually happening, the transition position?
We put into AHI for it. I'm not sure. I have the application and everything in. It was due 2 Fridays ago, I believe. So we should hear relatively soon. I've only heard positive feedback from AHI and the staff there that they're very excited and they think that it will get funded, but we won't know until those awards come out.
That'll be a new person that you would hire in your office?
This would be through a local not-for-profit agency. Baywood Center has offered to be the host agency, so they would actually employ the person. And of the mental health population that Sean spoke about, statistically about 65 to 75% of those folks will have a co-occurring serious substance abuse disorder. So this position would be able to do screening for both mental health, substance abuse, and do linkages to those services upon release.
Anyone else? Thank you, Carrie and Sean, for that information. We appreciate the fact that Rob had you come. Anything else, Rob?
Yep, one other quick update, and thank you both. One other quick update is the Joseph P. Dwyer Veterans Peer-to-Peer Services funding. I had presented that to the committee earlier this year as well to let you know that funding has been awarded to both Warren and Washington counties. The total funding annually for our counties was $185,000. We currently have recently received notice that we're receiving half-year funding this year, so it'll be $92,500.
Great.
Currently still in planning and discussion stages with both counties to try to determine how this funding will be, utilized, whether we'll be looking at hiring county employee, how it would be shared between two counties, whether it would be full-time, part-time. You can see in the back of the packet here, there's a little informational handout on the Veterans Joseph P. Dwyer program. And this is a New York State initiative, and on the last page under implementation, it tells what each county will follow. Administrative procedures, program procedures, evaluation criteria, etc. So far we haven't received any of that yet, so we're kind of in the dark as to, what are the expectations for setting up the program. But I did want to keep the committee apprised of, we have now received the funding, or at least that we are targeted to receive half of the funding this year, and then other counties that have received this funding for the first year have been able to roll over funding that's unspent, because I imagine we'll have difficulty spending all of even the half
Right.
funding this year by the time we get something up and I'll be bringing something back to the committee at some point for request for approval as to how to actually set up the program once we get the guidelines, etc.
Great. Administrator has a question for you, Rob.
Oh, I'm sorry, to go back to the restoration to competency. I think it's been in the governor's budget the past 2 or 3 years in the Article 7 bills, but it keeps getting taken out. Do you have any sense as to why that is? Why it doesn't make it through the full budget, state budget?
And what is that in regard to competency?
It's exactly what we were talking about, transitional services to allow, rather than to have prisoners sent out to the state psychiatric prisons, to have the services able to be provided with state reimbursement in local jails.
So now what you're talking about, is the restoration
Yes.
that happens for
Yes.
when somebody's declared incompetent.
Yeah.
So that's under Criminal Procedure Law 730. There has been a proposal over a number of years that those restorations could occur in local jails versus a state hospital. So when somebody is declared to be incompetent to stand trial, if they have felony charges, what happens is that they go to a state hospital, and there's a fairly significant chargeback to the counties. And it's somewhere around $800-900 is the per diem for the hospital's stay, and so half of that gets charged back to the county, or $400 to $500 a day. Usually restorations can be up to 60 days, typically, so it's a large budget item. Some people have had this proposal to try to do those restorations in local jails. The problem is the local jails just are not set up to do this type of intensive restoration process. You cannot do medication over objection in a jail, where you can in a hospital. And so that's why there's been resistance to that. And I think the medication over objection is the main thing that has been the sticking point.
Thanks.
But in general, local jails just aren't really set up to do that kind of programming.
Thank you. Anything else, Rob? Okay. Supervisor Lowe?
Rob, under the Joseph P. Dwyer program, how involved are you with our own veterans department in implementing and providing these services?
Okay, so when we first heard that we were getting the award, we thought, well, we should set up a local committee that would be involved in developing the program. So the veteran service coordinators from both counties, Warren and Washington, have been involved. We set up what was a preliminary advisory committee, so we had some local veterans that knew about it, and they wanted to be involved in developing the program. We have Cindy Roberts, who's a Gold Star mother, locally, who the bridge over 149 up here was dedicated in memory of her daughter. If you recall, there was a ceremony and everything. So she's very involved in it. But again, we've got the committee together, we've got people that are interested, we've got veteran input, but we just don't have the guidelines as to how to develop or implement this, what's expected of us, that's what we're waiting for.
Thank you. Thank you.
Right. Any other discussion? Anything else, Rob? Anyone in the audience have any questions, or are we good? All right. Thank you. Thank you very much again.
Yes, thank
Thank
you.
you very much for really for both.
Take care.
I think so.
Thank you.
Memory.
LAM.
Well,
A-R-E-E.
Thank you.
Another R there, I'm missing.
They're gonna send a note to...
I'm actually...
You know this is video. They can always watch it.
They can't read on this. But will, I want to send a note to, from the postcard. I can't remember anything today.
would you focus?
I'm sorry, what, where you go? You wanted,
Yeah.
is that what you're looking for?
Yeah, thanks, Tom.
Maybe get your meds.
I'll, stop into the apartment later.
Give you a lot.
We're all set now, Dee. I guess they all have their paperwork.
O-U-R. Good morning.
Good morning.
First name.
So the first item on our agenda is permission to submit our 2018-2019 New York Connects grant application in the amount of $195,398. This will allow us to run the New York Connects program in both Warren and Hamilton counties, and it is 100% funded.
The motion by Supervisor McGowan, seconded by Supervisor McDevitt. Questions? No questions? No discussion? All right, all those in favor? Aye. Opposed? Carried. Thank you.
And the only other item that we have is I just wanted to inform everybody we're having our senior picnic on Wednesday, September 12th at the Fish Hatchery in Lake George, or Warrensburg. We'll start serving coffee and donuts at 10, lunch will be at 12, and the cost is $5 per person. If you'd like to attend, please RSVP and pick up a ticket by August 31st, which is next Friday. We will be having informational booths, blood pressure clinic, a DJ, some games, prizes, things like that. So.
Very good. Thank you. I made sure I handed this flyer out to our senior citizens and thought maybe I would encourage some of them to go over, so.
Excellent, thank you.
All right. That's it. Any questions from the committee? Guess we're good then. Thank you, Dean. That was short.
Keep up the good work.
Nothing changed, did it, since I ran it?
LAM.
Yesterday? Okay. Thank you.
S-H-A-W-N.
Yeah.
There's that one. Very good, yeah.
Good morning, Julie, Chris, and Edward. We're all set.
Morning, everyone. Good morning. We have a couple of requests here. The first one is to request to renew the agreement with KMG Electronic Monitoring Services. They provide services for juveniles, such as various things that might be ordered through the family court that probation might ask for. We have a little change in this, so I'll just kind of go through it. This is to cover the period from July 1st through December 31st. This reflects just a portion of the 12-month contract period. This will be to align the term for the KMG juvenile contract to correspond with the KMG adult contract, which is handled by the probation department. So effective January 1st, the probation department from here on out will facilitate the continuation of the contractual agreement with KMG Services for Juveniles. Reason for that is that the Warren County Probation Department facilitates and oversees the physical aspect of the electronic monitoring programs for both adult and juvenile populations. So we're not really working directly with these youth, and it just makes more sense that they would take over this contract. And we have spoke with probation in regards to this, and they are in agreement with that.
All right, very good. Someone like to make the motion to approve that? Supervisor McGowan, seconded by Supervisor Sokol. Any questions? Supervisor Sokol.
How do you use money, I mean, I don't small amount, but the service, how can you reimburse it all?
Right now, we're paying the contract, so there is reimbursement. When it goes through probation, I have no idea how or if they get any reimbursement on their part. It's just, when probation was over in the new building, they worked a lot closer with our preventive department, and since they've moved back, preventive really isn't working together with probation. There really aren't any of our preventive children getting any of these services, so we really can't justify paying and getting reimbursed when none of our children are utilizing benefits.
Okay. Any other discussion? All right, all those in favor? Aye. Opposed? Carried. Thank you.
The second item we have is to request to fill a position of caseworker number 9 in the foster care unit. We had a resignation which is effective August 27th. The position is mandated and reimbursed as well.
All right, someone like to make that motion? Supervisor Loeb, seconded by Supervisor McGowan. Any discussion? All those in favor? Aye. Opposed? Carried. Thank you.
The last item that we have is to request to transfer funds from the salaries regular and unemployment insurance to salaries overtime and salaries part-time and health insurance cost reimbursement for a total amount of $76,000. This is to cover overtime, part-time salaries, and health insurance for the remainder of the year.
All right, someone like to make that motion? Supervisor Loeb, seconded by Supervisor Sokol. Any discussion? Supervisor Bramer.
Thanks, Chairman. What's going on here? Is there backstory here?
I think that Julie would probably be best to answer that question.
Part of the money is being put into part-time salary. I'm taking it out of the 110, which is full-time. We've had some empty positions, so the money is there and available. And I'm putting it into 130, which is part-time. And a lot of that really has come about because heat went year-round. And all of our heat people are considered part-time positions. So I have to pull the money from the 110 full-time line to put it in the part-time in order to pay our heat workers.
Is that we just changed those heat people to part-time? Is that what we just did?
They're not really, we have, they're temporary. And anyone who that's not eligible for benefits gets paid out of 130.
Okay.
So I guess I should call them temporary rather than part-time.
But that's what you're referring to, is that change we made?
Yes.
And it sounds better than 110 and 130.
Any other questions? All right, all those in favor?
Aye.
Opposed? Carried. Thank you.
All right, thank you. I just have a couple little updates that I'd like to mention here. In July, on the 24th, I met with James Dexter, who's the BOSI superintendent. We met for our initial planning meeting to continue through the upcoming year with our Warren County Interagency Committee meetings. This is a committee meeting involving various school systems and service providers so that we can collaborate, be on the same page, and educate each other on what services are available and find out where we might be able to improve services for children in our county. So we'll be continuing that this year. Our first big meeting actually is today. Later on today we'll be meeting
with the full committee and discussing our upcoming plans for the coming school year. On August 8th, I met with Michael Clark, who's the New York State Deputy Inspector General for Welfare. We discussed various methods and services for investigating and prosecuting local fraud in our county. So we met with our fraud unit, and we got a lot of good ideas from them, so it was nice of them to come. I think they also met with the Sheriff's Department, and we've got the Sheriff's Department and DSS got a couple good lines of feedback from them saying that it looks like, we work really well together, and we do. We have a lot of success there. Unfortunately, you always, in any line of work where there's funds, you're going to find a certain percentage of people that might take advantage of situations. And obviously this is public money, so we need to make sure that people are only utilizing these services if they're actually qualified to do so.
Good. Supervisor Bramer.
Thanks, Chairwoman. On that point, I know there was an article recently about a woman who was charged with fraud, and I just want to make the point that these people are, okay, she was charged with like $4,000 or something, but she was working a job and probably had, I'm just assuming, I don't know all the details, but I just wish we would take a broader look at these things, because people are working hard and they don't have benefits and they're trying to scrape by, and to say that they're taking advantage, I just think that we need to be careful about how we're framing this in a broader issue, because there's people out there who are struggling really hard to make ends meet, and maybe they're, taking more than they should from social service net, but maybe we should be changing the policies about how we distribute money to people who are trying to work hard and trying to get by. So I know you guys don't have control over that, but we do have control over the way that we frame the conversation locally.
I can add a little bit more insight into that. Our fraud department does work very closely with the clients to try and not have this happen. So we don't necessarily go forward and make law enforcement referrals if we can solve it before it gets to that point. We are sensitive to the issue that, the poverty rate in our county, I think is about 11% or so, 12% right now, which is just slightly below the national average, which means that there are a lot of people that are struggling, like you're saying. And the cost of living is pretty high overall compared, relatively speaking, to the median and the average income in our county. So we do have people that are eligible to have certain amount of income and still get benefits. So we're always, trying to walk that fine line to make sure that the consumers that we serve at DSS are getting everything that they are entitled to, because they are entitled to certain services, and they should.
As they get on their feet, we're not ripping the rug out from under them before they're completely stable. Let's make sure they're good to go, and then, they're set, and we can move on to helping the next person. Yeah.
All right, thank you. Is it Julie now? Oh, I'm sorry, Supervisor McGowan.
I see what you're saying there, but when it really gets down to, you have a certain questionnaire that you have to go by and to follow. And if someone does not give you the total accurate information and you find out afterwards, I'm happy to hear that you try to work that out. Because it could have just, they didn't understand, or they made a mistake, or they're struggling. And it goes back to a story that, that I remember someone telling me that they were $5 over the limit of getting some help that they really needed, $5 doesn't seem like a lot, but $5 over. So, people have a tendency to, I don't want to say become a creature of habit, but what we've established in some of our welfare systems, I think, in the past, it's been a little, people have learned these things and they, and they trade. So I agree with, educating a little bit more, and on the other hand, too, I'm thankful that at least we give them the opportunity. It says, look, there's a mistake here, and if you can't rectify it, then we have to do it legally, and, you gotta pull them in. But to leave out, maybe, I didn't know that my live-in boyfriend counted. That has his address over everything, just doesn't make sense to me,
Right.
And I'm
Any other
sorry if I
comments on that before Chris moves on? All right, Chris, we'll go back to you.
All right, thanks.
Mhm.
On the 9th of August, I had my first official commissioner formal training. Sheila Harrigan, who's the executive director of the New York State Public Welfare Association, along with her lead trainer, Beth Cattell, and Paul Brady, who's also another trainer. He's also a longtime commissioner and currently the commissioner of Schenectady County. Came up and spent the day discussing various issues and training me on some specific things that I was really wanting to learn more about. So it was a really productive day. We discussed things like contracts, budget, staffing, accessing and using various data for planning, training issues, things like that. So we had a really good day of training, and they're going to be coming back again at some point to go over some other things. So that was a good day. On the 13th of August, I attended the FEMA Emergency Response Training, which was presented by Amy Hirsch here in Warren County. And on the 20th of August, I went up to Countryside and met with Edward, and we went over a number of things, marketing strategies, emergency after-hours response plan, budget items, and updating the website, a few other little things that I can't really get into in this forum, but that was also a good meeting, so.
Thanks for coming.
Thank you.
Good. Glad to hear that you're going up to check on things up there, see how they're going there. That's good. All right.
That's it.
Does Julie have, so it's Julie then next, right?
Okay.
Okay.
For the overtime report, we're really just trying to keep it down as much as possible. We do have some new positions that are going to be starting, so anticipating that the training hours of overtime will remain up for the next couple of months. Training for caseworkers is quite intense. And as far as the budget, we're really pretty much on target. If you look at July through July 2017, we're pretty much right on target for through July 2018. Revenue is up a little bit over last year, which is always good. And I don't see any issues with either the expense or the revenue.
All right. Any questions from the committee? All right. Thank you, Julie. Edward. Morning.
A couple items here. First one, the action agenda. We would like to request to reclassify the position of account clerk number 2, grade 4, to senior account clerk, grade 7. The reclassified position would be senior account clerk, part-time. This is for an existing employee who is currently doing the duties of the senior account clerk. She has taken the exam and passed it. The salary, annualized salary is $38,328, grade 7.
The position to be deleted would be account clerk number 2, part-time, grade 4. That salary is $33,529. This proposal is to be an effective date of September 21st. The funds are in the budget for this new position, code A63130. Personnel officer has reviewed and approved the new position title. So we did all of the paperwork, and we request this reclassification.
Alrighty, would someone like to make that motion? Supervisor Loeb, seconded by Supervisor McGowan. Any questions? Supervisor Loeb.
Thank you, Madam Chair. I'm wondering if, I see the effective date is September 21st, if the person currently doing the job, or in that position is currently doing that job, why are we at least making it effective when we approve it, if not retroactive to a certain date? September 21st
That's
seems
the
to
board
be...
meeting.
So that is the, okay. All right, thank you.
Okay. Any other questions? Supervisor Sokol.
You're deleting this, or the other positions, correct? So you're not going to leave that at all, because otherwise you're going to create another.
Correct. Correct, that won't be needed. Yep, Yep.
All right. Anyone else? All right. All those in favor?
Aye.
Opposed? Carried. Thank you.
Okay, and then, let's see, one of the things we wanted to just sort of discuss was a possible room rate increase for our private rooms. The rate increase for the public funding rooms, the temporary assistance, that rate was increased from, I think it was like $101 per day to $105 per day. And as you know, costs go up, food is going up, and fuel, and so on and so forth. So we thought this might be an opportune time to also to increase our private room rate. Currently, we're charging $125 per day for a private room. So we thought maybe we might want to raise that by the same percent, maybe $130 per day, which will help us, cover our increased cost a little bit. So we'd like to, kind of maybe consider that to see if it would be possible. Yes.
A question, Supervisor McGowan.
Thanks, Ed, but I have to...
That's right, by procedure.
Madam Chair,
Sorry.
what is the national average of rooms that,
Yeah.
pretty much charge? Is it?
Well, I've called some homes, and I'm trying to get some rates in the area, and I haven't been successful yet in doing that, but I'll keep doing that. I'll keep checking around to see what the, kind of get a figure of what the, the rates are here locally.
I mean, that 130 is, really, if you think about it, sounds reasonably fair. $5. When's the last time we had a raise?
I'm not sure, but I think it's probably been a while.
So, and I know costs have gone up significantly. That would be, I think $5 is a fair limit.
Supervisor Bramer.
Thank you. Are our private rooms full?
We do have a number of private pay people in the private rooms, but I think we have like 2 left, 2 remaining. I think we have a total of 6 private rooms altogether.
I'm just thinking out loud, if we aren't full, and we are always trying to fill this place, are we going to be pricing people out, and then we don't have full rooms?
Yeah. Well, based on my experience, since I've been there, no one's ever really said that, that our room rates are too high. I think basically you look at price and value, what we offer there. We offer very good staffing ratios, probably among the highest in the business, 1 to 6 on days. We have a very experienced staff. Many of them have been there 25, 30, 35 years. They're very good. Our resident satisfaction rate on our latest questionnaire was like, 94.5% of our residents and families were either satisfied or very satisfied, and like 92.8% of them would recommend us. So, that's what they're getting for their money.
I understand why we don't have a waiting list then.
Why we don't have a waiting list?
Yeah.
Yeah.
And that would then say, well, okay, we have a lot of people interested, we could raise the rates and not, so get people in there.
Yeah.
Edward has worked very hard, though, at trying to get that census up, and it's not easy, and what he's found, if I'm not mistaken, Edward, there are a lot of people who would like to go there, but they need more services
Right.
than what you can provide for them, so consequently, that leaves them out of being...
Yeah, I think probably, one of the things that I've experienced, and I have a report if you want all the details, is that, for example, like in the past, 8 weeks, okay, I've been out consistent with our plan. I've been out talking, giving presentations, meeting with health centers, doctors, health clinics, United Way, Chambers of Commerce's, all the affinity groups, and they've all been very helpful in trying to partner with us or champion our cause and helping to distribute information to their clients because they know the good reputation of the home and they want to partner with a winner, somebody that's good. But during that time period, for example, we've had 17 referrals. Approximately 60% of them either, like Ms. Fraser said, needed a little more care than what we offer, or they were from out of county, which they don't qualify for us. So if they did, to answer your question, Supervisor Bramer, over time we probably would be full. But that's a big.
Out of county people, sorry.
Well, we do, but the problem is that the other counties will not pay us, for what, this has happened repeatedly. They will not pay, someone from Washington County Temporary Assistance will not pay for a Washington County resident to come to our home. And neither will the other counties, Essex, Schenectady, Saratoga, so if we could get them, theoretically, if we could get those people, statistically, we would be full and we would have a waiting list. But that's a big reason why we're not full, So of those 17 referrals we got, we admitted 2 of them, which is a very low conversion rate. And one gentleman wanted to stay home, and we're working on 2 or 3 others right now. They're in the hospital, they're going through rehab. They hope to be able to increase their functionality so they qualify for our home. So we're working on them. We're out there getting the information out, looking to admit as many as we can, but that's a big impediment, why we're not full. So we are researching the possibility of maybe adding more services. We don't know what that would entail, the cost and the investment of time and money and to retool to be able to do that. I don't know. It might be quite high. So we're looking at that. We're considering that. But that's what we're running up against, consistently since I've been here in the past year and a half.
Supervisor Beatty?
Thank you. So if one of our county residents goes to another county, do we pay that bill? County facility. Do we, Warren County, pay that bill?
Yeah, that was the question I had, and what I was told is that no, because they can come to us and we want to keep Warren County money in Warren County. Now the problem in Washington County is that, and I've heard this from families, there's a shortage of beds in Washington County. So it's not like Washington County keeps those people in their county because they have a shortage of beds and we have availability.
So how many beds do they have in Washington County?
Well, there are 3 adult homes, okay, and the one in Argyle is full. There are openings, and I think the one in Granville is almost full. The one in Cambridge may have openings, but from a lot of what families have told me, they don't want to go that far. They want to stay here, in Warren County.
Okay, so I'm just trying to get a handle on it. So Washington County has 3 facilities, and basically they're full and maybe a shortage of rooms.
Right.
Warren County, we can't get enough people to go into our facility.
We have availability, right.
So is this a county law or policy that if one county resident goes to another county, that county never reimburses the county in which they go to? Is that a practice? I mean, is that a law, or is that just what counties do?
I think it's their policy.
It's the county
I
policy.
think. I don't know if it's a law. I don't think it's a law.
I think that's the policy and procedure because temporary assistance is paid and reimbursed through New York State.
So that's what I'm sorry, I didn't read.
That would be considered a New York State policy.
So it's a New York State policy, so we don't reimburse. If I had to go to Washington County, Warren County would not reimburse Washington County. And if Washington County has
You have to establish residency.
You have to establish residency. So we can never expect that, to have other county residents come to our county and get and we can't expect that to be reimbursed.
Right, we need private pay.
Right, if they're private pay.
If they're private pay, it's a whole separate thing, right. Wow, okay, so we got great facilities, but we need customers. They've got facilities that may or may not be as good as ours, but they're busting at the seams.
Right.
We're trying to get a handle on it.
I know, it doesn't make sense, but,
And the cost is gonna be similar?
the cost, I would assume, is, I would assume.
Your
is-
rates are set by the state.
So the costs are gonna be similar. We have better facilities, but we just don't have people in Warren County that wanna,
Well, that
that
appears to be the situation, but again, as we're getting the word out, you know, we're making people aware of what we have. I know that, you know, another choice people have is home care. You know, there's a lot of home care in the area. They prefer to stay home. You know, years ago, I don't think you had the prevalence of home care as you do today. So those people would be coming to us. Now they can stay at home with home care. And by the time those people need some type of care, their status has increased to the point where, you know, they're beyond us. Their care needs are higher than what we can offer. So we're continuing to get the word out, getting information out there. We're continuing to get referrals. We just need more of them. You know.
One final comment. Washington County, I believe, has 40-something thousand residents. Am I correct on that? Right around there, 40-something thousand. We have 63 to 66,000 residents. They have more rooms, are busting at the seams. We have less rooms, and we can't get county residents. So, I'm just...
Out of county residents.
Well, we can't get county residents to fill up our facilities.
The other thing, too, I think you would have to figure out is that the majority of these homes in Washington County are smaller than us. The one in Granville is only 28
But
beds.
they're total rooms though, right? When you add their total rooms, isn't their total room availability compared to Warren County higher than ours?
Yeah, it is.
Okay, so they have more rooms, less population. We have less rooms, more population, and we can't fill ours. I don't know the disconnect, but that's a huge disconnect somewhere, am I right?
We have been working on that. Supervisor West, and then I'll get Mr. McDevitt.
Thank you.
Thank you,
From
Madam
Wire.
Chair. I have one question and one comment. The question is, can you define private pay for me?
Well, that would be-
I just want to understand.
Yeah, okay, that would be someone who basically is applying to come to our home, and they have liquid assets of greater than $3,000. That would be cash, you know, checking account, cash value life insurance. So in order to qualify for temporary assistance, they would have to spend down to the $3,000. And then at that point, you know, they would become temporary assistance. We would still get their Social Security check and their pension, but temporary assistance would pay the other portion of the fee. So anyone who has technically anyone who has an excess of $3,000 upon admission is generally considered to be private pay until they spend down.
So my comment is really a suggestion to the committee. And what spawned this was the increase in room rates and not necessarily understanding exactly what other homes charge. But I would suggest you kind of try to develop a comprehensive assessment of the values that we feel this home has as compared to what the competition has in county and out of county. And that's where you can look at if there's any kind of deficiencies in terms of how the market perceives this facility. It may be why it's not filled with as many people as we'd like. But, you know, I'm not sure about all the details and how to assess that, but I would think you'd want to look at, you know, what are the benefits of this and how does it compete against other facilities in the near region.
All right, thank you. Supervisor McDevitt.
Just a quick observation. I thought Supervisor Beatty was going down a reasonable line in terms of reimbursement among the counties. It seems like, on the face of it,
just doesn't make sense, okay? That it would seem that counties would want to work together. We're not really losing anything by that, so why don't we work together? Why don't we reach out to a member of the Board of Supervisors over there? Why don't we reach out to, a member of Social Services over there, commissioner, whatever? It would seem as if with a phone call, it would seem on the face of it, that you could kind of resolve this. Now, policies are interpreted, and, if you're talking to a commissioner, we have kind of a general policy. Well, I can modify that policy. I have that discretion. So all I'm saying is that doesn't seem to make any form of economic sense that we're not working together as counties to reimburse our brethren in a different county. Fill up Bed's facility.
Right. I know you have people out there, law-abiding, tax-paying people that need the care, that want to come to the home, and they're kind of stuck in limbo. And I've gotten calls from people at these other homes, and they don't like it there. The staffing isn't good. It's not clean. And I listen to them and I sympathize with them, but I really can't do much. There's not much that can be done.
All right, Supervisor Bramer, and then we need to move on to the last two items.
Side, have we looked at partnering with our own home care to see if they can come and...
Yeah.
Like,
we're looking into.
Yep.
Yeah, that was one of the suggestions that I was able to obtain at some of the conferences I've gone to, getting some information about the possibility of doing that. So we are looking into that. But again, and until I finish my research, I anticipate that it might involve, quite a bit of work, quite a bit of time, quite a bit of money. But again, I'm continuing to research that. But that is an option. That is a possible option. Yes.
Edward, just anecdotally, when you're discussing potentially coming in with residents who are interested in your facility, have you ever had a resident who would have been private pay who didn't come in because they thought the price was too high?
No.
Never?
No.
Okay.
No. Money's never been an object.
Okay.
They
Good
come
to know.
in and you just kind of sit back and let the home sell itself, and it's like, wow, this is where I want my mom and dad,
All right, we have a couple other things, Edward, that you want to report on?
I guess, well, you see the census there, and then the overtime report.
Any questions from the committee on the overtime or the census? Not. Any questions from the committee? Any questions from the audience? Mr. Conover?
Briefly, where do you see the budget? This year's budget? Revenue/expense.
Well, we're going to be reviewing that, I think, tomorrow. We have a meeting, so we're going to be going over that then, at that point in time. I think, our goal was obviously we had our meeting about a year ago. Our goal was obviously to try and get up to 40 residents. Right now, as of today, we have 32. We did get one on Friday, and they were private pay, and I'm working on 2 or 3 more. So I'm optimistic that if we keep getting the word out, keep getting information out, build a network of 20 or 30 organizations who champion our cause, who will be out there sending us referrals, recommending us that we can get our census up. So I'm hoping that we can get our revenue up substantially in the coming year through those efforts. We have started to do our own in-house laundry, which will save us a lot of money. By the end of this month, we'll be doing it all on our own. So far, it's working out good. We haven't had to hire any additional staff to do that, so that's going to be a big savings. When the wastewater project is completed, we'll be saving money there because we won't have that expense. So, taking all that into consideration, I'm optimistic that hopefully our finances will be improving next year because of the anticipated increase in revenue and the reduction in some of these costs.
Yes.
Did you get an evaluation of the status of the budget? Where you see
Been working on the budget for 2013 revenue goes up a little bit, they get more people in, the county share will go down. Right now, they're pretty even.
So the 18 budget, you think is on target now?
Is that
It's on target. Thank you.
All right. One last comment from Mr. Beatty, and then we need to wrap it up.
Okay, I get you, Greg, that's great, thank you.
You're welcome.
I know the overtime was an issue, and Chris mentioned that he was going to address that overtime issue, because we have to pay X amount of hours when something went wrong, even if it was 6 and 30 minutes, we're paying 4 hours, and so forth and so on. I was just wondering if we had an update on that, Chris or Edward or anybody. I mean, have we kind of fixed that, remember that situation was last month? or the month
Yes,
before?
we have been working on that, and yesterday we actually had a discussion about the plan for after-hours emergencies and how we could avoid the possibility of paying these overtimes, because if someone gets called in, even if it's for 20 minutes, they get paid 3 hours. So we have adjusted our plan. Edward will be the person who's called, and he will determine if it's actually necessary for someone to be called in, or if it's something that he can take care of himself without having to call in another employee from Buildings and Grounds or Scott Locher.
So that should help us with the overtime situation.
It'll help in one area, but there's multiple areas at the home that do sometimes require overtime, but that's one area where we can certainly eliminate some, not completely eliminate, but reduce the overtime. I think it will be helpful. Unfortunately, we have had a couple emergencies over the last couple of months that did require maintenance to come in. We had a water pipe break and flood a couple of rooms at one point. But I think that it's going to look better in the future.
A lot of the overtime is from the personal care staff, okay? And what we've done, we've hired, like, I might have mentioned this before, we've hired 2 per diem staff who are available. We train them to be institutional care aides. They work less than 40 hours per week, so they're available to fill in, for vacation times, sick times, and they've been doing that, and it's been working out very good, and that's been helpful to us in minimizing the overtime. So we'll continue with that plan.
Okay. I think with that, I'm going to entertain a motion to adjourn. First, people are waiting. Supervisor McDevitt, seconded by Supervisor Lowe. All those in favor? Aye. Opposed? Carried.
Welcome.
See you next month.
Thank you all.